So I was going to the University of Florida at the time, the late 90s, early 2000s. The internet boom was happening and computers were a big deal and the advent of all of that. So I also wanted to apply what I did to what I felt like was an industry that mattered, that had a real impact. And so that wasn't, for me, finance, or that wasn't other businesses, right? So that's what got me interested in healthcare. So I'm working on chronic pain and how primary care doctors and patients interact and how doctors get the information they need to best treat chronic pain. This is critically important because chronic pain is complex. It has physical components, it has mental components, it has social components, and the main medicine that we've been using for the past 20 plus years to take care of chronic pain, namely opioids, prescription opioids, have all kinds of risks associated with them. And so now doctors are increasingly faced with trying to best weigh the risks and the benefits of opioids versus other medications for chronic pain, all in really short visits typically, right? You go to a primary care doctor, you get 8-10 minutes with your doctor. Not a lot of time to parse through all the complexities of chronic pain, all the complexities and potential risks of prescription opioids and the potential abuse of these. And so this makes doctors' jobs really hard. So what we're trying to do is we're trying to help doctors sift through all of the information about patients' symptoms, information about patients' history, about the other doctors they've seen, about their potential risks of misuse or abuse of opioids. We're trying to help them sift through that by redesigning their computer systems, by setting up their computer systems so they get the right information, the information they need when they need it. What excites me about my field is the great potential of computers, of electronic health records, to improve health and health care. So we live in a world with massive amounts of information, medical information, health information, and computers have the potential to help parse that down, to deliver it to the right person at the right point in time, to ultimately help us make better treatment decisions and to give patients better outcomes. Receiving the Trailblazer Award is really a great honor for me. I think it's validation. I think it's validation on multiple levels. It's validation of all the work that I've done, all of the work that my team has done. Everything I do is team-based. I work with students, I work with faculty collaborators, I work with postdocs. So it's validation for all of us as a team. And I think most of all, it's validation that the work we're doing matters. And it matters beyond an academic journal. It matters to everyday people, doctors, and most importantly, patients.